Hello, I'm Dr. John Owens, and I am trained as a chiropractor, and I specialize in functional neurology. When I'm working on a patient and I'm starting the initial care, our focus is to do a neurological assessment that assesses brain function. What is this brain having a problem with in the environment? What is it that you can't do in the environment? And how does the metabolic side, the lifestyle that you're living, affect your neurology that's driving the pain syndromes that you're having? And so people can come in with chronic headaches, chronic low back pain, shoulder pain, knee pain. It doesn't really matter what the pain is. When a person's coming in with pain, in the absence of trauma, the pain that they're experiencing is actually brain-based pain. My job here is to take the chiropractic, integrate the neurology, if possible, integrate the metabolic changes. We tie it all together and we start rebuilding the body so it can react and interact in the environment in a safe way, and that decreases pain, improves function, and the patient feels better. Too many people in this country, by the time you're 65, are on between 7 to 12 different medications, depending on what the literature says. What if we can fix the lifestyle problem? Then you reduce the dependency on the medications and you improve the quality of life. It really starts with understanding how the body works and then the different therapies we can do to integrate. So when we're working on a new patient, we're always assess a number of factors. One, we assess their body's sensory ability to feel itself in space. Can that person do certain motor drills correctly? And then we assess the eye function, because the eyes are integrated to the balance and posture so you can walk free in an environment. And we have therapies like vibration plate, where a person's standing on a vibration plate, but they're doing eye exercises that stimulate the brain to reintegrate the eye function back to the postural function. Chronic pain patients, we have tools like PEMF, pulsed electromagnetic field therapy. We do oxygen therapy here, and we do therapies that help brain function and brain heal. We do therapies on nutrition and lifestyle management, so all kinds of specialized lab work. So many medical doctors will check for one autoimmune. We check for 22 different autoimmunes in the panels that we use. And so we begin managing the problems. If you have an inflamed GI tract and leaky gut, we have nutrition that begins healing those processes. If you have multiple autoimmune, we begin using nutrition that down-regulates the inflammation. Whether we're working on nutrition and diet or all the neurological problems, a part of the work we do here is to teach people what good movement is, to teach people the exercises to keep their eyes healthy, to teach people what a good diet is. And we take baby steps toward making simple lifestyle changes. Instead of being a doctor, I actually see myself as a coach. I don't want to be the one telling you what to do. I'm a guide, but we're also coaching and showing you better ways to do things. And then we find what works for you, and then we walk that pathway together so you're not doing it alone. My end goal with every patient is that they have the knowledge to live a pain-free and drug-free life.